Mr. Speaker, I stand before this Honorable House today to shed light on the dire situation surrounding the General Hospital. This is not just a matter of bricks and mortar. It is a matter of trust, transparency, and accountability in governance. The handling of the General Hospital project epitomizes the lack of planning and excessive politicking that seems to characterize infrastructure development, fueling districts and cynicism about government's promises within our communities. I say this as a member of Parliament of a constituency that saw its major government hospital, the General Hospital, raised down with what has now become a never-to-be-fulfilled promise to reconstruct a hospital meeting international standards. Considering the fact that the announcement to demolish the General Hospital was made at the onset of COVID-19, a pandemic that took the lives of 1,462 compatriots and whose economic impact is now the general excuse for government's failure and economic ruin, raises even more questions as to the planning that undermined the project in its entirety. Prior to its demolition, the General Hospital, established in the early 1960s, a 5-story building, had a 5-bedroom emergency unit, obstetrics and gynecology department, surgical department, male and female wards, a general outpatient department, a waste management facility, a mortuary, an incinerator, and a newer building for family planning, imaging, and HIV services built with the support of the U.S. government after President Obama's 2009 visit to the maternal ward of the hospital. Although the hospital had few facilities as enumerated, it served communities around La, Osu, Teshin as a major referral center and a primary point of call for a varied number of medical complications and emergencies.
The minister responsible for health is not with us. Mr. Speaker, I do know for a fact that there are certain developments that I thought if the minister had been here, he would have been in a position to respond to. The fact of the matter is that when the agreement relating to the hospital came to this house, it came alongside 6 other hospitals, including one in my own backyard, the polyclinic at Swabi. Mr. Speaker, what has happened is that subsequent to the engagement with the IMF, funding from those sources, that is from that agreement that Parliament approved of here in Parliament, Mr. Speaker, Parliament, the funding has been withheld by the sponsors. Mr. Speaker, until the nation is giving a clean bill of health by the IMF, it's going to be difficult for the funding to be released, which is why government now wants to resort to some other means.
Majority Leader, I direct that the Minister for Health comes to the House to brief the House on the state of the completion of the La Government Hospital. I so direct.